Welcome to our deep dive into the world of Cavalier King Charles Spaniels, specifically a condition that affects their nervous system called myoclonus.
Yeah.
We're going to be taking a close look at its characteristics and clinical course, as detailed in a study
Right.
from the Journal of Veterinary Internal Medicine.
Interesting.
Myoclonus, in simple terms, involves those involuntary, shock-like muscle jerks.
Yeah.
You might have experienced yourself, but occurring much more frequently in these dogs.
Yeah, it's fascinating, isn't it? What makes this study so compelling is its approach. The researchers didn't just capture a snapshot of myoclonus.
Right.
They sought to understand its full evolution.
Oh, well.
They used questionnaires and video footage from owners of 27 Cavaliers,
Okay.
creating a comprehensive picture of how the condition unfolds over time.
It sounds like they were very thorough. So what did they find?
Well,
What were the common signs of myoclonus in these dogs?
the study highlighted that myoclonus most prominently affected the head region. Think rapid eye blinking, almost like a persistent wink,
Yeah.
and head nodding as if the dog is constantly agreeing with something.
It's almost as if the dog has developed a nervous tic.
In a way, yes. However, the study also revealed that myoclonus wasn't limited to the head.
Right.
It could involve other body parts like the forelimbs, facial muscles, hind limbs, and even the back and abdomen.
Okay.
The involvement varied from dog to dog.
So while head movements were common, the presentation could differ significantly.
Exactly.
Was there any specific trigger for these episodes?
That's where it gets really interesting.
Okay.
The study found that most episodes occurred spontaneously,
Uh-huh.
often when the dog was at rest.
Right.
Only a small number of owners reported potential triggers like stress,
Okay.
being touched, excitement, or sudden movements.
That must be so unsettling for the owners not knowing when these episodes might happen.
Right.
What about the progression of myoclonus?
Sure.
Did the researchers observe any changes over time?
Unfortunately, the study indicated that myoclonus tends to worsen over time,
Okay.
in most cases both in frequency and severity.
Wow.
This progression was observed regardless of whether the dog received treatment or not.
So even with treatment, the condition could continue to progress. That's the burning question. What could be causing this progression?
Well, the researchers proposed a possible link to neurodegenerative processes. The progressive nature of myoclonus and the behavioral changes observed in many of the dogs
Right.
led them to believe that there might be a gradual deterioration happening in the brain.
That's concerning. You mentioned behavioral changes. Can you elaborate on what kinds of changes were observed?
Of the 27 dogs in the study, 18 developed noticeable behavioral shifts alongside the myoclonus.
Okay.
These included becoming more clingy to their owners, a decrease in their usual playfulness,
Right.
increased restlessness, and in some cases even aggression.
So these dogs weren't just experiencing physical symptoms. Their personalities and interactions with their owners were changing as well. Did the researchers find any connection between the severity of the myoclonus and these behavioral changes?
They did. The study noted that the dogs exhibiting behavioral changes were generally older
Okay.
and had been experiencing myoclonus for a longer period
Right.
compared to those without behavioral changes. This observation lends further weight to the theory of a progressive neurological process at play.
That makes a lot of sense. Now, I know that some people might wonder about epilepsy,
Sure.
since involuntary muscle jerks can sometimes be associated with seizures.
Yeah.
Did this study address this connection?
Yes, it did. It's
Okay.
important to differentiate.
Okay.
While myoclonus can be a feature of certain types of epilepsy,
Right.
this study found a relatively low occurrence of generalized tonic-clonic seizures, the kind most people associate with epilepsy.
Yeah.
In this group of Cavaliers, only 4 out of the 27 dogs experienced these seizures.
So while there might be a link, in some cases, myoclonus in these Cavaliers doesn't necessarily mean the dog also has epilepsy.
Right.
This study also looked at treatment options, didn't it?
Yeah.
Did they find anything effective?
They specifically looked at Levetiracetam,
Okay.
a common anti-seizure medication.
Right.
Interestingly, it was initially effective in some dogs, even leading to the complete cessation of myoclonus episodes.
Wow.
However, the study revealed a concerning trend.
What happened? Did the medication stop working?
Many dogs who initially benefited from Levetiracetam experienced a resurgence of their myoclonus symptoms over time.
Oh.
Even with adjustments to the dosage, the episodes began to occur again, often increasing in frequency and severity.
That must have been disheartening for the owners to see those improvements fade. What did the researchers say about this decrease in effectiveness? Was it simply a case of the dogs becoming tolerant to the medication?
That is one possibility, of course. However, the study suggests that this waning effectiveness might be another indication of the potential underlying neurodegenerative process we discussed earlier. It's possible that as the brain slowly changes, the medication becomes less able to control the symptoms over time. Yeah.
Wow.
Yeah. Welcome back to our deep dive into myoclonus in Cavalier King Charles Spaniels.
Yeah.
As we discussed in part 1, this condition often indicates something more profound happening within the brain.
And we left off on that point, the potential for an underlying neurodegenerative process driving the progression of both myoclonus and the associated behavioral changes.
Precisely. What's particularly intriguing about this study is the detailed description of those behavioral changes. These weren't subtle shifts. They were significant enough to impact the dog's quality of life and their relationships with their owners.
You mentioned that these changes seem to be intertwined with the progression of the myoclonus itself.
Yes.
What were some of the specific behavioral changes the researchers documented?
The most common change reported by owners was a marked increase in clinginess and dependence on their humans. These Cavaliers, once independent and playful, began to seek constant reassurance and stay close to their owners.
So it's like the myoclonus and perhaps the underlying brain changes were creating a heightened sense of anxiety and vulnerability in these dogs.
That's a good way to put it. And this clinginess often coincided with a decrease in playfulness. Dogs who previously exhibited boundless energy showed less interest in their favorite toys and activities.
It's sad to think about these typically vibrant dogs losing their zest for life. Were there any other significant behavioral changes?
Yes. Some owners reported increased restlessness and anxiety. These Cavaliers would pace unable to settle or exhibit other signs of unease.
It sounded like they were struggling to find comfort. Did the study mention any other concerning behavioral changes?
Unfortunately, some dogs even exhibited aggression.
Wow.
These Cavaliers, once known for their gentle nature, might snarl, snap, or even bite seemingly out of character.
So these weren't just isolated incidents of grumpiness. It sounds like there was a genuine shift in their temperament, possibly stemming from those neurological changes.
Exactly. While this study didn't explore the reasons behind these aggressive behaviors in detail, it's important to remember that any dog experiencing pain discomfort or neurological disturbances can exhibit changes in behavior, including aggression.
That reinforces the importance of seeking veterinary attention if you notice any significant behavioral changes in your dog.
Yes.
Particularly if those changes occur alongside other symptoms like myoclonus.
Absolutely. Early intervention is crucial. Now, going back to the potential for an underlying neurodegenerative process, while this study was observational and couldn't definitively prove a causal link, the researchers' argument is compelling given the progressive nature of myoclonus and the accompanying behavioral changes.
The fact that both the myoclonus and the behavioral changes tended to worsen over time regardless of treatment certainly suggests that some sort of deterioration is happening in the brain. What could be causing this neurodegeneration in these Cavaliers?
That's the crux of the matter, isn't it? Unlocking the mystery of what's driving this condition could open doors for more targeted treatments and even preventive measures.
Did the study offer any clues about potential causes?
While the study didn't pinpoint a specific cause, it did emphasize the need for further research into possible genetic predispositions, environmental factors, or a combination of both.
It sounds like there's a lot more to uncover. What areas of research do you think hold the most promise for solving this puzzle?
Genetic research is a promising avenue. And by studying the DNA of Cavaliers with myoclonus, researchers might identify specific genes or gene mutations that increase the risk of developing this condition.
So we might find that some Cavaliers carry a genetic predisposition that makes them more susceptible to this neurodegenerative process.
Exactly. Identifying those genes could help us understand the underlying mechanisms and pave the way for genetic testing, allowing breeders to make informed decisions to reduce the incidence of this condition in future generations.
That could have a significant impact on the well-being of Cavaliers down the line. Are there any other research avenues worth exploring?
Another area of interest is the study of environmental factors. Researchers are investigating whether exposure to certain toxins, pollutants, or even dietary factors might play a role in triggering or accelerating neurodegeneration in susceptible dogs.
So it's possible that something in a dog's everyday environment could be contributing to this neurological decline.
Yes, and understanding this interplay between genes and the environment is crucial.
Wow.
It's a complex dance that ultimately influences a dog's neurological health.
While this research continues, what can Cavalier owners do right now to support their dogs if they're showing signs of myoclonus?
Early detection and veterinary intervention are paramount.
Okay.
If you observe those involuntary muscle jerks or any accompanying behavioral changes in your Cavalier,
Right.
consult your veterinarian without delay.
Okay.
Early diagnosis allows for prompt symptom management and could potentially slow down the progression of the condition.
And even though there's no current cure for myoclonus, are there ways to manage the symptoms and improve the dog's quality of life?
There are medications like Levetiracetam can help control the muscle jerks even if temporarily. Managing those behavioral changes often requires a multi-pronged approach,
Right.
combining medication, behavioral modification techniques,
Yep.
and adjustments to the environment.
Yep.
For instance, if a dog is experiencing increased anxiety and clinginess,
Yeah.
providing a safe, predictable, and comforting environment can make a world of difference.
So it's about creating a calm space for the dog, establishing a consistent routine, and offering plenty of reassurance.
Exactly. And if aggression becomes a concern,
Right.
it's vital to work with a certified veterinary behaviorist.
Okay.
They can help identify the dog's triggers, develop a behavior modification plan, and guide owners on managing those aggressive behaviors safely.
It's important to remember that aggression is often a symptom of an underlying issue, not a character flaw.
Precisely. And in the case of myoclonus and Cavaliers, those underlying issues might reside within the complexities of the brain.
This deep dive has been incredibly insightful. Stay tuned for part 3 as we wrap up our exploration into the world of myoclonus in these beloved spaniels. We'll delve into the importance of responsible pet ownership when facing complex neurological conditions. Welcome back to our deep dive into myoclonus in Cavalier King Charles Spaniels. In this final part, we'll shift our focus to the broader implications of this research,
Okay.
particularly when it comes to responsible pet ownership.
What's fascinating here is that the study doesn't just shed light on a neurological condition.
Right.
It also prompts us to reflect on our role in shaping the health and well-being of our canine companions.
And one of the questions that often arises with breed-specific conditions is the impact of breeding practices.
Yeah.
Did the study address this aspect at all?
While the study didn't delve into specific breeding practices,
Okay.
it did acknowledge that myoclonus appears to be more prevalent in Cavalier King Charles Spaniels.
Right.
Then, in other breeds, this observation naturally leads to discussions about selective breeding and its potential role in perpetuating certain health conditions.
So if we're focusing on certain physical traits during breeding,
Yeah.
like that adorable flat face and those expressive eyes,
Right.
are we inadvertently increasing the risk of other health issues like myoclonus?
It's a delicate balance. That's why ethical breeding practices are paramount.
Right.
Responsible breeders prioritize the health and well-being of their dogs above all else.
Okay.
They screen their breeding stock for known genetic conditions,
Yeah.
make informed decisions about pairings,
Right.
and strive to produce puppies that are not only beautiful,
Yeah.
but also healthy and resilient.
So it's about looking beyond those superficial traits and considering the dog's overall genetic heritage and potential health risks.
Precisely. And this brings us to the responsibility of potential Cavalier owners.
Okay.
If you're considering welcoming one of these charming dogs into your life, it's crucial to be informed about the breed's potential health concerns, including myoclonus.
So do your research talk to reputable breeders
Yeah,
and inquire about the health history of the parents and any genetic testing that's been done?
absolutely. This preparation includes understanding that myoclonus, if it develops, might require ongoing management, including medication lifestyle adjustments,
Right.
and potentially even behavioral interventions.
It's a commitment that extends beyond those puppy dog eyes and wagging tails.
Indeed. And that's where the importance of building a strong bond with your Cavalier comes in.
Yeah.
That bond, that deep connection built on trust and mutual understanding can make all the difference in helping your dog navigate the challenges of myoclonus
Right.
and any other health issues that might arise.
It's about being attuned to your dog's needs, recognizing subtle changes in their behavior,
Yes.
and seeking veterinary attention promptly if you notice anything amiss.
And remember, even with a progressive condition like myoclonus, there's still so much joy and love to be shared. These Cavaliers, with their sweet and gentle nature, have so much to offer.
Right.
And with the right care and support, they can live fulfilling lives.
As we wrap up this deep dive, let's leave our listeners with a final thought.
Okay.
Owning a dog, is a privilege, a journey filled with both joys and challenges. When it comes to conditions like myoclonus in Cavaliers, knowledge is power. By understanding this condition, advocating for responsible breeding practices, and committing to providing the best possible care, we can ensure that these beloved dogs continue to enrich our lives for generations to come.
From Vet Neurojar, keep those minds-inspired hearts light and tails wagging.